Imagine a condition so prevalent yet so shrouded in silence, affecting millions worldwide. This is the reality of urinary incontinence, a condition that can deeply impact a person's quality of life. Often dismissed as a natural part of aging or an embarrassing secret, urinary incontinence deserves our attention and understanding. This essay aims to shed light on this common condition, exploring its causes, symptoms, treatments, and the profound ways it affects both men and women. By breaking down the stigma surrounding incontinence, we can empower individuals to seek help and regain control of their bladder health. Despite its prevalence, urinary incontinence remains a topic often met with hushed tones and averted gazes. This silence only serves to perpetuate feelings of shame and isolation for those living with the condition. It's time to break free from these constraints and foster open conversations about bladder health. By understanding the complexities of urinary incontinence, we can create a more supportive and informed society where individuals feel empowered to seek the help they deserve. Urinary incontinence, in its simplest terms, refers to the involuntary loss of urine. This means that an individual leaks urine unintentionally, often at inconvenient times. This loss of bladder control can range from a few drops to larger amounts, impacting daily activities, social interactions, and overall well-being. Contrary to popular belief, urinary incontinence is not a normal part of aging, although age can be a contributing factor. To truly grasp the concept of urinary incontinence, it's essential to understand the basic anatomy of the urinary system. The bladder, a hollow muscular organ, stores urine produced by the kidneys. When the bladder is full, signals are sent to the brain, indicating the need to urinate. During urination, the bladder muscles contract, and the urethra, a tube connecting the bladder to the outside of the body, relaxes, allowing urine to flow out. Urinary incontinence occurs when there's a disruption in this intricate process, leading to unintentional leakage. Urinary incontinence is not a one-size-fits-all condition. It manifests in various forms, each with its own set of characteristics and underlying causes. Understanding the different types of incontinence is crucial for accurate diagnosis and effective treatment. Let's delve into the most common types. 1. Stress incontinence. This type of incontinence is characterized by urine leakage during activities that put pressure on the bladder, such as coughing, sneezing, laughing, exercising, or lifting heavy objects. It often stems from weakened pelvic floor muscles, which play a vital role in supporting the bladder and urethra. 2. Urge incontinence. Individuals with urge incontinence experience a sudden and intense urge to urinate, followed by an involuntary loss of urine. This overwhelming urge can be difficult, if not impossible, to suppress. Urge incontinence is frequently linked to an overactive bladder, a condition where the bladder muscles contract involuntarily. 3. Overflow incontinence. In this type of incontinence, the bladder doesn't empty completely, leading to frequent or constant dribbling of urine. Overflow incontinence can occur in both men and women, but is more common in men, often due to an enlarged prostate or other blockages that obstruct the flow of urine. 4. Mixed incontinence. As the name suggests, mixed incontinence involves a combination of different types of incontinence, most commonly stress and urge incontinence. This combination can make diagnosis and management more challenging, requiring a multifaceted approach to treatment. Urinary incontinence is rarely caused by a single factor, but rather a complex interplay of various contributing elements. These causes can be broadly categorized into 1. Pelvic floor muscle weakness. The pelvic floor muscles, a group of muscles located in the pelvic region, play a crucial role in supporting the bladder, uterus, in women, and rectum. Weakening of these muscles, often due to pregnancy, childbirth, obesity, chronic coughing, or simply aging, can compromise bladder control and increase the risk of incontinence. 2. Neurological disorders. Conditions affecting the nervous system, such as stroke, multiple sclerosis, Parkinson's disease, and spinal cord injuries, can disrupt the intricate communication pathways between the brain and the bladder, leading to urinary incontinence. 3. Urinary tract infections, UTIs. Infections in the urinary tract, particularly in the bladder, can irritate the bladder lining and cause a sudden urge to urinate, often accompanied by pain or burning. While UTIs themselves don't cause incontinence, they can exacerbate existing incontinence symptoms or trigger temporary incontinence. 4. Medications. Certain medications such as diuretics, water pills, muscle relaxants, sedatives, and some antidepressants can interfere with bladder function and increase the likelihood of experiencing urinary incontinence. 5. Lifestyle factors. Certain lifestyle choices can contribute to bladder problems, including excessive caffeine or alcohol consumption, smoking, and being overweight or obese. These factors can irritate the bladder, increase urine production, or put added pressure on the pelvic floor muscles, contributing to incontinence. Section 5. The gender divide. How incontinence affects men and women differently. While urinary incontinence can affect anyone, regardless of gender, the prevalence and specific types of incontinence vary significantly between men and women. Understanding these gender-specific differences is crucial for tailored diagnosis, treatment, and support. Women are significantly more likely to experience urinary incontinence than men. This increased prevalence is largely attributed to the unique anatomical and physiological changes women undergo throughout their lives, particularly during pregnancy and childbirth. The physical stress of pregnancy and vaginal delivery can weaken the pelvic floor muscles and stretch the supporting tissues, increasing the risk of stress incontinence. Additionally, hormonal fluctuations during menopause can also contribute to bladder control issues. Men, while less likely to experience incontinence overall, face their own set of risk factors. An enlarged prostate, a common condition as men age, can press on the urethra, obstructing urine flow and leading to overflow incontinence. Prostate surgery, while often necessary, can also damage nerves and muscles involved in bladder control, potentially resulting in temporary or permanent incontinence. Section 6. Recognizing the signs, symptoms of urinary incontinence. Recognizing the symptoms of urinary incontinence is the first step towards seeking help and regaining control of your bladder health. While the most obvious symptom is the involuntary leakage of urine, other subtle signs should not be ignored. The frequency and severity of urine leakage can vary significantly among individuals, ranging from occasional dribbling to a complete loss of bladder control. Some common symptoms of urinary incontinence include leaking urine when coughing, sneezing, laughing, or exercising, known as stress incontinence. A sudden, intense urge to urinate, often followed by leakage, which is called urge incontinence. Frequent urination, often in small amounts. Waking up at night to urinate, also known as nocturia. Feeling like you haven't completely emptied your bladder after urinating. A weak or interrupted urine stream. Straining to urinate. If you experience any of these symptoms, it's essential to consult with a healthcare professional to determine the underlying cause and discuss appropriate treatment options. Section 7. Diagnosis. Uncovering the root of the problem. Diagnosing urinary incontinence involves a comprehensive evaluation to identify the underlying cause and determine the most effective course of treatment. This typically begins with a detailed medical history, including any pre-existing conditions, medications, and lifestyle factors that may be contributing to bladder control issues. A physical exam, including a pelvic exam, may be conducted to assess muscle strength and identify any abnormalities. Your doctor may also request a urinalysis to rule out infections or other underlying medical conditions. Additional tests, such as a bladder diary to track urination patterns or urodynamic testing to evaluate bladder function, may be recommended to gain a more comprehensive understanding of your condition. By identifying the root cause of your incontinence, your healthcare provider can develop a personalized treatment plan tailored to your specific needs. Section 8. Treatment options. Navigating the path to relief. The good news is that urinary incontinence can often be managed or cured with the right treatment. Treatment varies based on the type and severity of incontinence. Lifestyle changes like pelvic floor exercises can improve bladder control. Kegels strengthen pelvic muscles, reducing urine leakage. Bladder training helps retrain the bladder to hold urine longer. Weight loss can reduce pressure on the bladder. Dietary changes like limiting caffeine may help. Medications can relax bladder muscles and reduce spasms. Medical devices like pessaries support the bladder. Surgery is for severe cases unresponsive to other treatments. Options include sling procedures and artificial urinary sphincters. Section 9. Prevention and lifestyle changes. Taking charge of bladder health. Adopting a proactive approach to bladder health can reduce your risk and improve bladder control. Maintain a healthy weight through diet and exercise. Practice Kegel exercises to strengthen pelvic floor muscles. Eat a balanced diet rich in fruits, vegetables, and whole grains. Stay hydrated with plenty of water. Quit smoking to protect bladder health.